All right. So as I mentioned, I think earlier when we started talking about different types of groups, I did for one class assign the recorded version of this, but because it is an integral part of the class as part of one of the main goals of the class, I did want to spend some time and go through this presentation as a class live. And so I'm hoping for most of us it's a review. For others of us that didn't get to the recording, I hope this fills in some gaps for some of the things we're trying to understand in this part two of the class and understanding different types of groups and group processes. So we're going to look at psychosocial support groups, treatment groups, and process groups. Those are kind of the three broad categories of different types of groups. So we're going to explore these and the role. We're going to focus on trauma caused by things like domestic violence, loss, or cancer diagnosis. So if you remember, we went through the Seeking Safety program. That is for individuals who have diagnosable post-traumatic stress disorder plus co-occurring addiction, okay? Kind of combine those two. When we're talking about this trauma, we're focusing on things that happen, for example, in the home, such as domestic violence, things like being diagnosed with a dangerous disease such as cancer, or grief processes such as loss of a loved one. Um, and each of these can occur in different settings, as we'll see as well. So what we'll do is we'll go through each type of group. We'll look how they're defined, what their key characteristics are, and what the benefits of them are, okay? Um, and then we'll do a little bit of comparison and case application for each type of the group as we move through. So that's kind of our goal for today, as we hoped. So we're going to start with psychosocial support groups. These groups tend to be structured groups, meaning that they have specific information that should be covered each group. Okay. So it's kind of that's the psycho. Sometimes these are called psychoeducational groups. Okay. So those terms are kind of interchangeable because the idea is that we're providing some type of education, some type of information on a topic. Okay. The reason why I prefer the term psychosocial is because it also allows individuals, one, to frame what happened to them through the educational process, but also realize that other people have gone through what they're going through and that they have a shared experience with other people and they're not alone and they're isolated. So part of it is the educational, but then it is the emotional and social supports when individuals share their experiences. So when we look at the basic purpose, there should be a term here. There should be three bullet points. One is education, okay? So in the domestic violence psychosocial or psychoeducational groups, we often talk about what is known as the power wheel. And this power wheel is all of the different dynamics that often domestic abusers use to control their victim and to make it so their victim, it almost makes it impossible for the victim just to leave the offender and to seek help. So that's kind of the educational part. And then going through each of the components, so there's financial, there's family, there's friends, there's all different types of ways of control. Then the facilitator allows the group members to kind of talk about their experience with financial abuse, psychological abuse, emotional abuse. And in that process, they start to normalize because the other group members go, oh, I experienced that. I experienced that too. And it reduces that feeling of isolation, that they're alone and they're not, and that they're the only ones who have experienced all of these different things. Now, I will state that in a lot of cases, because everything is individual, people have their individual experiences. So in some ways, it allows other group members to realize different ways their abusers had been abusing them. But in some cases, a few group members may have experienced, for example, financial abuse. This is where the abuser takes complete and total control over the finances of the family and the individual, and to the point that the victim doesn't even, if they have a job, they don't even know how much they're getting paid unless they go to their HR department. But a few group members might say that is something that I experience, and then other group members may say, well, that's not something they experience. So it also allows them to see the diversity among different ways that people have experienced abuse. Okay. When it comes to, so that's domestic violence survivor groups, grief support for those who have lost loved ones. Um, in grief support, when we're talking about loved ones, we usually go through the grief cycle. Um, and then we always mention that it's not a linear thing, that it's a very circular and growing thing. And we talk about where each group members are in their grief experience. And I don't want to use the word grief cycle because that assumes that it's fixed. But we go through where they are within their grief, and it allows each other to support each other where they're at in the grief process. And that's not something you necessarily get when you're doing individual counseling, when you're in front of a therapist, because in the support group, you're getting support from individuals who have experienced the same type of loss. Okay. Key features then of the psychosocial groups is peer-led or facilitated by a professional. Support groups, either there's two ways that they can be facilitated. One is you have the professional facilitator. So that is, for example, in the field of domestic violence, you may have a survivor advocate or a survivor counselor, a survivor who's a case manager, and they're kind of professionals. They've been taught about the power and control will, and they facilitate the conversation. In peer-led psychoeducational groups, it's where you get senior members who have been through the group process. In the beginning, I should back up a little bit. In the beginning, it's usually facilitated by a professional. But then near the end of the group and stuff, the professional kind of starts to recruit peers to start facilitating the group. Now, in some cases, you probably have heard the term peer support programs. They're becoming very popular. And in those, the peers who have gone through, for example, addiction or surviving grief or domestic violence and have gone through the recovery process can go and be then trained to facilitate a group in a peer support type program. So there's a couple ways that peer-led groups are happening. One, either they recruited as a group member gets through the end of their group and asked to facilitate another group. In other programs, peers are employed a lot of times. Sometimes they're volunteer. They go through some type of training program. And then they start to facilitate groups for the organization or whoever it is doing it. Okay. The emphasis and the importance of psychosocial groups, and this is is to emphasize the shared experience and provide mutual support. The education component of a psychoeducational group or psychosocial group is meant to facilitate shared experience and mutual support for each other. Um, and so in a way, it's kind of that byproduct of what the kind of real intent of what the group is. And that's to make a person feel like they're not isolated, they're not lonely, they're not that they can see other people's successes and work through failures together. Okay. And the education is just a way to help structure that experience. Okay. So that's the social support group. Again, I should put some other terms that have been used for these psychoeducational group. But the key aspect is it's meant to be a source of support. Okay. Now, a treatment group, on the other hand, is a group that is always facilitated by a professional facilitator. And usually, this is someone, well, there's different levels of treatment facilitators. There are some that may have just a bachelor's degree, sometimes associate degrees, depending on where they're working at, and they've been trained to do a certain type of treatment group, such as a cognitive behavioral group, a relapse prevention group, a post-traumatic stress seeking safety group, and they've been trained to facilitate that group. In other types of treatment groups where the issue becomes more complex, a lot of times they're usually facilitated by a licensed bachelor social worker or a master's level counselor. Okay. In those treatment groups, usually what you're dealing with is a more severe type of mental illness where different treatment in the group may need to change dependent upon the needs of the group members. Okay. So in one case, it's kind of it's a trained individual who does a fixed manuscripted type of treatment. In the other one, it's done by a licensed master level person or a bachelor level social worker who then is treating more severe, usually co-occurring disorders because they may need to adjust the type of treatment that they're providing. But the purpose of a treatment group is to achieve some type of therapeutic outcome through, again, a structured intervention. Now, what is meant by a therapeutic outcome? If we look at it from a pure measurement perspective, let's look at, for example, a depression group. So a therapeutic outcome may be the alleviation of depression symptoms. So they give maybe at the beginning of groups, they give the the Beck depression scale. And a therapeutic outcome would be to reduce the score on that measure or alleviate some depressive symptom of some type. Okay. In some cases, it may be broader. It may also include things like, so suffering from, again, we'll use depression as an example, that the group gets the person to the point where they can be employed full time, or they get some type of housing or get into some educational program. And so sometimes they can be behavioral, but usually the therapeutic outcome has to do with some type of relief of a symptom of some type. Okay. And that gets to the purpose that's mentioned here. So when we look at, for example, when we looked at post-traumatic stress disorder, we may look at reduction in drinking because of symptoms. We may look at reduction in flashbacks when we're doing some type of exposure therapy. And so we're looking for some type of relief of symptoms, okay? Some of the examples we've used in this group, in this class, is of course cognitive behavioral therapy, where you have very structured assignments, structured sessions. But some other areas that treatment groups have been used in is support, for example, cancer patients to address things like anxiety and coping with the reality of the disease and how the disease is influencing their home life, their work life, their social life, and how to now manage those symptoms within each of those contexts or each of those domains. Okay. Some key features of treatment groups is they tend to be what evidence-based therapeutic techniques, meaning that they've shown to basically work in most contexts, and that they show efficacy in the ability to, for example, relieve post-traumatic stress symptoms, help cancer patients cope in the different domains of their life with their new disease, the disease that they have, okay? And the other key feature, if you notice, I use the term Beck depression inventory. The other aspect of a treatment group is that they're goal-oriented, and they usually look at some measurable outcome for the individual, okay? And so, for example, when we go back to the seeking safety group, sometimes the measurable outcomes is, did you use the coping skills that we learned last week in group? That's a measurable outcome. When we look at cognitive behavioral therapy, usually we use the Beck depression inventory at different stages of the treatment group to see if the scores have changed. Okay. So that's kind of the notion behind a quote unquote treatment group. And you'll notice that it's different than our psychoeducational group. Our psychoeducational group, while we hope uses evidence-based information, such as the power and control will and all of those things, the main goal of the psychoeducational or psychosocial group is to provide support for the individuals. In this treatment group, the goal is the alleviation of some type of symptom that has been manifested by some disease state, whether it be a mental illness or a physical illness. Okay. So then the last kind of, well, I think the last one. So the last group is now a process group. Okay. Now, usually a process group occurs either after a psychosocial group or at some point during a treatment group. Okay. But normally people aren't placed directly into a process group based on an assessment. Usually what you want with a process group is you want people with some knowledge, either through the treatment process or the psychosocial process, about their condition, about their situation. Okay. You also want them to realize that they're not alone at this point. So using the psychosocial support system or during the treatment group process, seeing other people go through the treatment process. Okay. But the goal of a process group is to focus on exploring individuals' emotions, behaviors, and interpersonal dynamics. And it's usually done, if you look at the key features down here, it's usually done in more of an open-ended process, meaning that process groups are not structured. You won't find a manual, for example, on how to um, 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 do a domestic violence process group. okay? You won't find a manual that talks about how to deal with the complexity of a cancer diagnosis, as the examples suggest here, okay? And hence, it's important to start with the psychosocial or the treatment group process so that they can come into the process group with some knowledge of what they're experiencing and why they're experiencing it. Okay. But the purpose is to deepen self-awareness of an individual's individual experience about what they're going through, and to enhance things like emotional expression and relational skills. If you think about it, a process group is for individuals who are ready now to move on from their disordered behavior or their situation. They want to feel the healing process, if you want to put it in those terms. Okay. So examples of a process group are survivors of a domestic violence processing their emotional wounds, or a patient who's navigating the complex feelings about having a cancer diagnosis and what that means for them on a very deep individual level. Now, as you would probably guess, a process group requires a lot of training. Okay, these groups are usually conducted by a master or doctoral level individual. And usually, if they're hired by an organization, they are definitely licensed. Because if these groups, if they're not done by someone who has gone through the right level of supervision, who hasn't shown their ability to be a licensed professional and an educational professional, these groups can put an organization at a lot of risk. If I look at malpractice suits with some organizations, a lot of those malpractice suits deal with that organization having their process groups conducted by non-licensed individuals, okay? Because these groups can bring up a lot of emotions and feelings that were not expressed in the treatment process or the psychoeducational process, that you really need someone who can help people navigate that through that in a non-structured way. um, and again, so the key features of this is it's open-ended discussion, and the therapist is there to help individuals understand what they're going through, remind them of things that they learned in the treatment and psychosocial groups to help deal with these deeper, stronger emotions that they're now experiencing. And it also focuses on group dynamic and interaction. One of the important parts of a process group is talking about how other people make them feel when they talk to them about their cancer diagnosis. So, or their diagnosis or what they're going through. As an example, how people treat someone differently when they disclose that they've been diagnosed with cancer. Okay. Um, Interestingly, and this is part of a process group that is an example that you would deal with, is when a person is diagnosed with cancer, they may have 3 PhDs, a medical doctorate. They may be a very educated and well-researched person, but for some reason, when they get that cancer diagnosis, people seem to forget that and start treating them more childlike and more as if they are helpless and all of those things. And so in a process group, this is where a person who's been diagnosed with cancer really can explore how people changed in how they interacted with them because they have a diagnosis of cancer. Um, and yes, it's something that I do want to make the class aware of. Please be cautious of when someone says, I've been diagnosed with this disease. Don't watch your pitch of voice because research shows that your pitch of voice goes to what's called child voice. You start talking to them in a higher pitch. You start talking to them slower. You start being more using empathetic child terms, like if a child were to get hurt. And that does have a huge impact on these individuals. But this is an example of something that these individuals work through the process group process. Okay. So on the individual level, it's exploring emotions and behaviors. It's on the interaction social level or interpersonal level, it's about exploring people's reactions to them as they disclose that they have this disease, or they go in the survivor group, they start to express that they're survivors of domestic violence. And in that case, that's where you start to get things like victim blaming, questions like, well, why didn't you leave? In a lot of process groups that I've sat through, they talk a lot about how parents just didn't believe them, that they were being abused, those types of emotions that occur when people want to deny that their child was a victim and now a survivor of abuse, or when someone just doesn't understand why they stayed so long. Okay. And this is where those deeper processes tend to be processed, as you would say. Okay. So, just some key differences. Just some key differences. So when we look at the aspects of facilitation, focus, structure, and goals, and the key aspects of the differences between these, when we look at facilitation, psychoeducational groups or psychosocial groups tend to either be peer-led or professional-led. Treatment and process groups tend to be led by trained professionals. When we look at the focus of each of these, again, on the psychosocial group, emotional support and shared experiences are important. When we look at treatment, we're looking at symptom reduction and skill building. And again, I want to just note these key differences. Process groups are about emotional processing and relational dynamics. Notice with psychosocial support groups, it's about emotional support. And now we're going through emotional processing, shared experience to relational dynamics now, and people understanding who we are. Okay. When we look at the structure of these groups, psychosocial, they tend to be a little bit more flexible and discussion based. So you bring up a topic, you educate about the topic, and then you discuss the topic. Treatment group tend to be structured and very intervention based. Okay. Process groups, you'll notice that it uses the term semi-structured. Okay. And that seems strange when you use the word process group. But what we mean by semi-structured is that the group itself is structured in some way to provide consistency and expectancy for what the person is going to experience when they come to that process group. Okay. Because those are the things that individuals who are really deeply processing these deep emotional and relational dynamics really need in order to feel safe and secure as they're processing those. So that's what semi-structured means, is that the group itself, the topics may not necessarily be structured. It may not be as manualized as the treatment group, and there might not be a formal educational component, but the way the group is facilitated is semi-structured to provide consistency and predictability for the individual. And again, when we go to the goals, we're looking for normalization and connection when we're dealing with psychosocial groups, and symptom management and measurable outcomes when we're dealing with treatment groups. And with the process groups, we're looking at emotional insights and personal growth. So again, if you look at the progression, we start with basic education, normalizing that this happened, creating connection and not feeling isolated. And then we're moving to symptom management and measurable outcomes. And then again, when we go into the process group, we're looking for that deeper emotional insight and personal growth. Okay. So, um, so let's just kind of go through then some of the applications. So when we're dealing with relationship violence, psychosocial groups, what our goal is to provide a safe place for survivors to share. Okay. When we're looking at treatment group, think again back to seeking safety. It's addressing the trauma symptoms through either some type of trauma focused therapy or cognitive behavioral therapy. When it comes to process groups, we're exploring things like trust and self esteem and relationship patterns post abuse. So we're all trying to help the person grow now that they have symptoms managed from trauma and they're in a safe place. How do you start to trust again after having yourself violated by your intimate partner? When we look at loss of a loved one, psychosocial support groups allow people to share their grief and normalize mourning. A lot of people who lose someone often feel like they're the only ones that get depressed, the only ones who go through denial, the only person who goes through bargaining, as examples. And a psychoeducational group allows the person to see that what they're going through is normal for someone to experience. A treatment group is for complicated grief or depression. So, what we mean by this is treatment groups, when it comes to, for example, loss of a loved one, is for those who go through the grief cycle, but they're never really able to come out of the grief cycle. Okay. And so it's someone who their life has become unlivable in a sense. They can't work, they can't sleep, or maybe they sleep too much. They can't engage in social relationships because of the grief and depression that they're experiencing from the loss of a loved one. Process groups are to discuss and process unresolved feelings about the loss. So, something that I saw typical in loss groups is people expressing what they didn't resolve with that person. That feeling of guilt that the last thing that they talked to them about was an argument, and those type of unresolved issues. Okay. When we look at cancer diagnosis, or when we go beyond this disease diagnosis of some type, again, for psychosocial groups, we're looking at that peer support and navigating the treatment and survivorship process. What does that look like? For treatment, we're usually focusing on managing anxiety and increasing something called emotional resiliency. For a lot of individuals who have a chronic disease diagnosis, uh, feelings of failure, feelings of self-defeat often drive the disease process. Okay. Indeed, when we find that people who are diagnosed with a chronic disease, their disease will accelerate, usually because of this feeling of defeat. Okay. And so the term emotional resiliency is this idea that we need to convert these feelings of defeat into feelings of overcoming those feelings of despair, of being defeated by your body, and those types of things. Okay, so that's what's meant by focusing on managing feelings of emotional resiliency. Process groups look at how look at those existential questions about how, especially if it's a very deadly form of cancer or chronic disease, how do you deal with those existential questions of death and despair? But the other thing that process groups do with cancer diagnosis is look at identity change. You now have something that is now part of you that wasn't there before. So, what does it mean to be a cancer survivor? What does it mean to be someone who is actively going through the disease process? Okay. But on this, it's realizing that cancer or the disease is part of who you are, but it doesn't define who you are. Okay, again, when we go back up here to treatment groups to emotional resiliency, one way that a disease can again accelerate once it's diagnosed is when that disease becomes all encompassing for the individual, meaning that the only thing that they start to focus on is that disease and that disease process. And they forget, for example, well, they don't forget, but they stop living in their other zones of existence, such as being a father or a mother, being a teacher or a student. Sometimes they stop practicing their faith or their religion, and other areas of their identity. They kind of put to the background, and now they've become that disease. Okay. And part of a process group is to help an individual understand that they're more than a cancer survivor. They're more than a heart disease survivor. And so those are kind of the ideas behind applications of a process group when it comes to things like diagnosis of a cancer or that those kind of things. Okay. So in conclusion for this lecture, one thing we need to understand is that each type of group address a unique aspect of recovery, okay? Where psychoeducational fosters connection, treatment groups focus on targeted symptoms, and process groups to promote deep emotional healing, okay? And understanding the distinctions ensures appropriate group placement for trauma survivors, okay? All right, so I am going to exit out of here. I'm going to stop our sharing.